Hello, friends. Nowadays, we are seeing that very young people, either celebrity or non-celebrity, that is different thing. Celebrity has no tag, but young peoples are going to get heart attack, and that is the what is the main reason? That is diet, stress, and physical overexertion, and work stress, financial stress, family stress can be a factor. So, people eat haphazardly, either fried food or fast food. People do meetings and enjoying outside restaurant foods. People eat lot of simple carbohydrate foods, saturated fatty acid rich food. So there are in young life blockages are going to develop uh, from bad cholesterol, triglyceride, inflammation, and that blockage is, though it does not obstruct the artery totally, 70% or totally, but a small blockage is like 30%, 20% rupture by exertion, overexertion, physical or emotional stress, chemicals, rupture it, cortisol, catecholamines leads to inflammation and rupture, 30% blockage, and suddenly get heart attack. Because that initial stage plaque is of thin cover, and when a plaque gradually enlarge at later age of life, that is covered with thick cover. So thin cover plaque rupture and leads to 100% clot blockage in the artery, and that leads to heart attack, cardiac arrest, and that is the reason of improper food of simple carbohydrate and saturated fat and fast food and non-veg food. So you have to reduce your weight, you have to take healthy food, alkaline food, food with full of grains, fruits, vegetables. You have to avoid saturated milk products. You have to avoid fast food like burger, pastries, pizzas, French fries, uh, then sodas, cold drinks, and juices which are selling in the market in packaging that is very harmful, because you doesn't read the label that how much sodium and how much fat is calories inside that juice, packed juice. So you have to avoid. And in young life, due to thin cap on the blockage, physical overexertion or emotional overexertion or hypertension or diabetes can rupture the plaque and leads to heart attack. But nothing to panic. You have to take EECP treatment, that is US FDA approved treatment, that develop collaterals around the uh, arteries, that is 100% block. 100% artery block has no another heart attack will occur. That is 100% block. And removing that block from 100% artery by rotablator or stenting is very, very difficult, and it damages the endothelium of the heart. So you have to take EECP to develop multiple collaterals in the heart and diverting the route of blood supply to the heart muscles, and uh, angiogenesis and arteriogenesis occurs due to vascular growth factor secretion, hepatocyte-rich growth factor secretion, nitrous oxide secretion, and due to depletion of volume overload and decrease of cardiac hypertrophy, multiple vessels are going to develop in the heart surrounding the blocked artery. So in future, if you have taken EECP, in spite you have uh, heart attack or acute coronary syndrome or heart disease in the young life, but if you have taken EECP, then in future if you have any heart events like ACS or heart attack, that will not endanger your life, because a lot of collaterals are supplying the heart muscle, so you will survive the heart attack. That is the beauty of EECP. And EECP is specially very useful for weak heart, whose heart pumping has been destroyed, decreased by the previous heart attack or cardiomyopathy dilated. So EECP is a heart tonic, work as a second heart, and it rejuvenates heart by developing revascularization in the heart by non-surgical way. So young people has to do aerobic exercise, not anaerobic gym exercise, or not overdo work and take stress, and eat high fiber plant based diet. That is very important. Avoiding simple carbohydrates and saturated fat is most important, because their plaques are covered by thin plaque, thin cap cover, so it will rupture. But the beauty of EECP is that young people also, if they have been detected high bad cholesterol or inflammation, and they have been shown blockages, immediately they have to take EECP, so they protect themselves from future heart attack. That is the beauty of EECP, that develops multiple collaterals and protect you from future events. No treatment can give this benefit. It is USA FDA, CE FDA approved, Indian FDA approved treatment, and that is non-surgical, non-invasive. So Dr. Hiten Shah at Heart and Vascular Care Advanced EECP Center at Ahmedabad, we have multiple centers in different parts of the India. So you can take advantage of EECP once your blood reports or blood reports are not good, or angiography so blockage. Immediately, in spite of doing stenting or surgical intervention, adopt EECP and be rejuvenated heart. Thank you.